Recording.
Okay.
So first, I was last time I heard you were in Northern California. So I was just wondering. So what are you doing in Montana?
I actually have been here almost 10 years. Well, actually 10 years now. And I have a small private practice and I've been consulting in communities all over the country, Canada and other places. And yeah, I just got tired of working for agencies and got tired of what I call the bureaucratic domestic violence.
Oh yes,
And so I said, I can't do this anymore. And so it's been a lot better since I'm on my own boss, and like that. So yeah, and
yeah, I can
since
certainly relate to that.
yeah,
Yeah. So the focus of what I wanted to talk about is kind of getting into the nuts and bolts of how we work with um, indigenous clients of like what works and um, I we loved your book Healing the Soul Wound, and um, I just wanted to get your current thoughts on what works. We're definitely interested in we're interested in all people. I mean,
yeah,
people with all kinds of conditions, but especially we're interested in working with people with opiate use disorder because that's so common here in Maine, and and it's what um, I'm consulting about, and it's what Barbara is doing, my wife Barbara. Um, so that's kind of um, the gist of what we wanted to talk to you about, and I'm just really happy for you to talk about anything you want to talk about. Having said that, because it's great to reconnect with you after so many years.
I know I hadn't seen you. I get your emails and I see your conferences, and this is Coyote guys are already still doing it.
Yeah.
Uh, yeah, I'm doing the Soul Wound. I don't know if that was the first edition because the second edition came up in the last few months, and so I added to it, and so I thought I was done writing about all this stuff, and I really didn't want to do anymore. But when a random call came that they wanted to do a second edition, I had a chapter on veterans that I had been dealing with, and so we added that and a few other things, and so we have the second edition of Healing the Soul Wound.
Oh,
And
that's great. I'll have to get the second edition.
uh, yeah, it's a little bit off the grid. I mean, not like the first one was off the grid. This one's a little bit more, and so just caution your readers that it might be a bit more than what people bargained for. But I thought it's my swan song, and getting too old to pretend, so I just put it out and see what happens. And so, but yeah, and your specifics here on the opiate. Oh, and I see Barbara Melangai. Is that how you say your name?
Main guy. Yeah.
Mengai. Oh, Mengai. Okay. And so yeah, you're really small in the corner.
That's fine.
And actually, I speak specific to that, not in depth, but, we're all dealing with the opiate abuse situation, here in this part of the world, also methamphetamine, and of course the usual alcohol and some of the others. And my understanding, it all goes back to my root teacher, the teachings he gave me on the so-called addiction. And I say it that way because addiction is just the surface of something a lot deeper. And that much deeper, of course, the title of the book says it is the soul wound, and also known as historical trauma. And so a lot of these, the addictions sit on top of that, and if we don't go underneath, then we have what we have now. And when I heard the numbers on opiate deaths, I thought it was a yearly number, And then I thought it was a monthly number, and then I found out it was like a daily number of deaths, which was really, really high. And so, that got me to thinking back to Root Teacher and his teachings, and my understanding again of any diagnosis, and I need to say something about diagnosing, because in the Western construct, I mean, as you know, because of the English language, when we diagnose anything, we're naming it, and we're nouning it. And once we noun it, we objectify it. And once we objectify it, then it separates us from it. And so it's that separation that causes the distance and the problem in addressing it. And in most indigenous languages, and I've talked to a lot of people who speak their language as to how their language works. And so far, I mean, this is from people from all over the world have told me that what carries the meaning in their language is more of a verbing understanding. So reality is a movement and it's not static. So it's difficult and at times impossible to objectify. Therefore, it's impossible to separate. And and we don't separate, then it gives a whole different reality to to the human's perception, the experience that the human being is having. And so therefore when somebody presents and they say they have they're addicted to heroin or one of the prescribed medicines, opiates, uh, I stay away from telling them that's who they are, because I don't want to name them. And when we talk to Native people, as you know, traditionally there's what I call naming ceremonies, and this is where the person in power, the healer, the shaman, the doctor, whatever the person presents as, they're a person of power. So when they say you are addicted to opiates, then that's basically a naming ceremony, and now the person in the very next in-breath breathes that in, and they walk away with a whole screenplay that goes with being an opiate addict. So my take on that is to, instead of saying you are anything, I always use language of probability, which is, the quantum people are telling us that's really how the universe is wired, because even matter that we think is kind of solid, it's probabilistic also. And and so instead of saying you are addicted to, you're an addict, I said maybe the spirit of opiates is visiting you. And that's a very different understanding, because now it's in movement. If it's visiting, I mean, it's in movement. And also it's alive. And all of these medicines, they're all medicines, whether it's opiates or marijuana or cocaine or methamphetamine, they all come from the natural world, and they're sacred. And so there is a relationship, a way of relating to medicine that is prescribed in the original instructions. And this is where, most Native people, even really colonized Native people, understand that there is a relationship with medicine. And so when I suggest to them that they might be abusing medicine, and that's a big deal to most Native people, because they don't want to do that, because medicine encompasses the whole reality, the whole cosmology, all of that. And now we're getting into spiritual turf, and no one wants to be a bad shaman or practice bad medicine. And I'll never forget, I was working in this inpatient program where all Native, and during the intakes, once they would talk to other people, I would ask them, well, why do you think you're doing this? Whatever it is that they were using and abusing. And a lot of them would say, well, it's because I'm being witched. And almost to the person, they would say that, even if they were still detoxing or if they had been detoxed, they would say that. And the understanding is that there was some kind of an energy that was being projected to them. And every time I would say, well, yeah, you're right. And I actually even know who's doing that. And of course, that would get them very interested. And I would say, well, every time you pick up whatever medicine you pick up, and you take it without authorization, without a license, basically, then I would ask him another question: who are you if you're using medicine and you're not a medicine person? And everyone would answer correctly, and they would say, well, that means I'm a witch or I'm a sorcerer. I says, yeah, and that's who's sending the sorcery to you, because you're doing it to yourself, because you're violating all the rules of how medicine is supposed to be used and practiced. And of course, all of them know how the healers usually use medicine, and medicine, has the practitioner has a relationship with it, either through a dream or a vision or whatnot. They are told which medicine will work for what patient, and so there's the offerings, and there's a whole protocol that goes with that. And so when I explained to them that by them just jumping all the protocol, they're basically activating the dark side of the medicine, then the dark side of the medicine is going to take something. Because if you haven't given something consciously, it'll take something unconsciously. And this is where the losses that happen to people around abusing medicine become very real. And if one were to listen to any AA meeting today, the war stories, as they're called, most of those war stories involve loss. I lost my job, I lost my car, I lost my family, and so in my simple mind, I always ask the simplest question, and I said, well, I wonder who took it, because nothing is ever really lost, it just goes somewhere else. And this is where it opens it up again. Well, it's the spirit that medicine took from you because you abused it. And to tell a native person that's a big deal. You abuse medicine and you're practicing sorcery. And my first law of the universe, according to me, is that there's no free lunch. And so everything balances out in the universe. And if you take something and you don't get something back, then the universe or creator, however you believe, will take something from you. And that's where a lot of the losses come in the process. So when I see that hundreds of people are dying every week from opiate abuse, use, it tells me that people are violating a very sacred medicine, which is, also used, for helping with pain and a lot of other uses for opiates. And so then the medicine starts taking. And as my Dene relatives say, usually takes a five-fingered one. And a five-fingered one is a human being. And that's the ultimate cost for abusing medicine. And so that's kind of my, my kind of take around, I guess, theoretical take around all this. But the patients, even the ones that haven't detoxed, when I talk about it, they all understand it. And I'll never forget a lot of the inpatient folks, after I would tell them that, they would get a little bit upset. And the reason they were upset is because they would say to me, how come nobody ever told me about this? Because now that they understood it, they had a whole different relationship already. The relationship was shape-shifting with whatever they were doing in their life. And so that was kind of my intro to it. And then, of course, there's the therapies and all that we can talk in a little bit. So I just want to make sure that that makes sense to you and Barbara.
Oh, absolutely. Especially the part about it being a verb, that we're always living out these lives, these stories, um, and that, I think what Western culture does is it takes these still photographs and says, okay, well, this is it, rather than it's a whole movie
Yeah,
that's unfolding.
yeah, yeah.
Yeah. And I know you wrote about hybrid. I was looking at the book, and you said that hybrid is the term that emerged from post-colonial thinking. It means that there can be two or more ways of knowing, and that this can be a harmonious process. And we've been especially taken by Albert Marshall's concept of two-eyed seeing, which is similar to your concept of hybrid. And really, what we're trying to figure out is how do we live in both worlds? Because there's this world of the bureaucracy and the Western diagnoses and treatment plans and having to couch everything in cognitive behavior therapy terms. And there's this other world of spirits and spirit visitation and misusing the medicine, not creating a safe space for the medicine to be, and the fact that everything is simultaneously spiritual, physical, emotional, community, social. You know, how do we negotiate those two worlds? And if you could speak to some of that, that would be really helpful.
Well, in bureaucracies, I was in bureaucracies for, over 2 decades, working with tribal entities, urban, actually even worked for IHS for 4 years, worked in hospitals for 6 years. And a lot of practitioners ask me that a lot because they kind of know what needs to be done, but then they feel like they're stuck in doing it in a way that doesn't seem to be very effective. And the way I did it and continue to do it is I just did it. And even working in IHS, which has all the federal rules and CFRs and all that, instead of asking permission, I just did what needed to be done, and we had a staff, and we implemented what we thought was appropriate. And what ended up happening is that the bureaucracy ended up taking credit for it, which was fine. Let him take credit because it became more effective. We actually were able to bill at a higher rate to where we collected even more insurance money than was being collected before. And one of the ways, if somebody really is having difficulty with the theory or shape shifting the theory, this is your gig, Lewis. I mean, this is coyote medicine.
Mm, right.
This is where you really have to walk that razor's edge, just like a coyote, and they kind of walk sideways like that, right? And so if you're using smudging or using this kind of ceremonial stuff, and of course all of psychotherapy is a ceremony, and you need to make a progress note that some bureaucrat's going to read and approve, but you don't have to say that. You can say, we used objects relations therapy combined with cognitive measures because you do have to integrate consciously what's going on. So that's a cognition. And the whole Navajo way of understanding, when I have asked old Navajo people as to what to do to get it, to help myself, their main instruction is think good thoughts. Well, that's CBT, 101 right there. And so within traditional methods, there is language, and this is where we really have to become really well-versed in Western theory so that we can then extrapolate something from Western theory that we can use. And of course, Jung gave us a lot of that leeway, but some places don't like Jung. And so then we have to go back and use other jargon to explain what it is we're doing. And then after a while, and that's why I write this stuff, because if it's written, then slowly it can start becoming part of the paradigm where, why are you saying that? Well, according to so-and-so chapter, this and that. And so then it could become maybe a best practice. And in Indian country, it should be a lot easier, especially if it's a program that is funded by the tribes in sovereignty. But again, because of colonization, Sometimes even the tribes have a lot of problems with indigenous ways of being because of the colonizing. And so it becomes a process of helping some of the leadership. And then, of course, when we get to the Western docs, well, that's a whole other thing because in my experience, especially working in IHS hospitals, uh, a lot of the docs just did not want it, and and they, they would leave me alone, but they were still very leery, and they would say so openly that they weren't too sure as to what was going on, even though they could see the effectiveness. It would make them very uncomfortable because especially if you're an MD type of doc, then you're under even more constraints, because now you're just dealing kind of with body and chemicals and medicines of those sorts, and even with like the psychotropics and in any kind of medicine, I always tell the docs or the pharmacists before you give it to the patient, sacramentalize it, because one of the big issues in Indian country is non-compliance, and and it's been my experience that when docs or pharmacists actually pray for the medicine or offer it ceremoniously to the patient, it becomes different. It shapeshifts, and then the patients will actually take it. And it's the same medicine. I mean, it's still made by Pfizer or whoever, but when you pray on it and the patient knows you're doing that. And I had a young pharmacist from the Gallup Indian Medical Center years ago after I talked about this. He came in, he was in uniform, he was Commissioned Corps. And he told me, he says, I'll never give medicine to Native people the way I've been trained. I will always pray for it from now on. And so it didn't cost anything extra. He didn't have to write a grant. He could just do it, right? And and here he's doing it, and he wasn't Native. And so here he's giving medicine to Native people in a sacred way, which makes it more effective. So I think there's a lot more room in there to navigate this stuff, and I really think that we're really ready as a humanity to start seeing things more spiritually. And if we don't, we're just not going to be here. I mean, especially the last few weeks and all that's going on, it tells us, which of course, the wounding goes deeper into the spirit. So it's going to create even a bigger hunger for opiates and those things that numb the spirit.
Yeah. That's a really good point that, and even with giving buprenorphine, that one can pray over it or
Mhm.
with it or in alignment with it.
Yeah.
Yeah. Yeah. With all medicine. And sometimes, even though, I mean, you're right, I've been on this coyote path of having a foot in each world. And sometimes I forget to pray over the medicine.
Yeah.
And that's such a good point. And I think the other thing that I really enjoyed in your book was this idea um, that illness has a consciousness, that it's something to be addressed. And I wondered if you could say more about that.
Yeah, and regardless of what the category of illness, whether it's in the physical body, the mind, the spirit, uh, and I see people, not just Native people, but I see people from all cultures, and they resonate with this because it's goes back to what I call, or some of the older people in the Native world call, the original instructions. I guess Jung would call it archetypes or pre-archetypes, where we're wired to understand things in a certain way. And then, of course, Jung said our psyches are more primitive than we think. We think we're modern, but our psyches are still way, way back in the original way of perceiving consciousness. And and all illness, all substances have a consciousness to it, and and this is where now the patient can take proactive measures on their own behalf, to where whether it's diabetes or opiate use or cancer or whatever, what I try to get the patient to understand is that here's an entity, here's a visitor that's visiting you, and in in Western medicine, the idea is to get rid of it, and because Western philosophy, Western medicine derives from that, it's adversarial because of the subject-object relationship. There's no connection, and so then what we want to do is get rid of the sickness. And within a lot of traditional healing circles, that's unthinkable. What we do is we make a relative out of it, and we try to understand what it's trying to tell us. And so, like the spirit of diabetes, and again, I was doing a talk in one of the communities towards the middle of the country, and most of the doctor commission corps and the head doc was a four striper, so he was way up the food chain. And it was a conference on diabetes, and I talked about how instead of saying you are a diabetic, to say perhaps the spirit of diabetes is visiting you, and then to establish a relationship with it and then figure out where that spirit came from. And and at the end of my talk, the head doc was going to give a talk, and to my surprise, he went up there and said that he would never diagnose anybody as a diabetic, that he would always say, perhaps the spirit of diabetes is visiting you. And if it's visiting you, that means it's in movement. And then by doing certain protocols, traditional protocols, you can learn something from it, or you can shapeshift it and perhaps even, heal yourself, which would mean that you still have a relationship with it, even though it doesn't have to make your body sick. And so that's kind of the protocol that I try to give the people I see, regardless of what they present with, that there's something, whatever it is that's bothering, knows it's bothering them. And even like with the COVID-19, I saw something out of India recently where, very poor community, and there was a group of women there giving offerings to the spirit of COVID. They're giving sweets and some other things to start that relationship with whatever this thing is, because it's alive, and if it's alive, it has life, and if it has life, there's a knowing. It knows stuff, and it makes it a lot more interesting for the patient to realize that now I can actually go and relate to this on an ongoing basis rather than keep fighting it, because Newton's first law, for every action there's an opposite and equal reaction. So if you push on whatever the diagnosis is, it's going to push back. And so I tell people, we really know that for sure. So don't do that, because it's going to push back harder, and instead relate to it. And there's a protocol that I've been taught by different traditional providers where, let's say that the issue is the opiate, and I never tell people to stop or to keep using, because in my experience, at least for me, that's never worked. To tell somebody to stop using opiates or stop using alcohol, that for me, that doesn't work. Instead, I tell them to make a relative out of it. And it's the next time you're going to use whatever, let's say, whatever opiate you're going to use, before you take it, identify yourself to it, because if you're using that medicine, it's really rude for you to just take it without any etiquette. And the way that this works is you tell it your name, tell it your parents' name, grandparents, as far back as you can go. And then you ask it, well, what's your name? And who are your parents? Who are your grandparents? And what is it that you want? And then give it a gift. Most in native way, give it some tobacco. And now that completely shifts the relationship. And a lot of people over the years have really gotten upset at me, because they said, the thing you told me about talking to the spirit of the medicine, it's ruined my drinking, because now I can't just drink in peace, because I think about that stuff you said, and I just can't do it the same way. So at the very least, it creates a little bit of a cognitive, monkey wrench in there to where now the person isn't drinking the same way. So already something shifted just by being conscious that there is a relationship. And then usually what happens is that the spirit of the substance will respond. Sometimes it responds verbally right there, sometimes in dreams. And so now the whole relationship is changed to where it's becoming more medicine because now they're respecting it. They have a relationship, conscious one versus an unconscious one. And so that's, again, with any of the diagnoses. And also, I work with some patients who are going to have serious surgeries around taking parts of their body out of them. And I suggested to them to offer whatever body part back to the mystery as their flesh offering, as their sacrifice, for the well-being of all other human beings. And don't waste it. And so that's been one of my mantras: is don't waste your suffering. And that's integral to a lot of native ceremony. We're entering Sundance season here in the plains, and that is the crux of that, is that you're giving, your flesh offering for the well-being of the earth and all human beings. And then that is the very crux of Christianity also, to where it's a flesh offering that needed to happen, the blood sacrifice. And, and it's been really interesting because most of the surgeons that have been involved in these surgeries have been really open to that. So, I would tell the patient, talk to the nurse or whoever, and take some red cloth and take some cedar, because most of that stuff gets incinerated, and have them put it in there and put the cedar on it before they burn it, and it becomes your offering back to the Creator. And it's a very empowering thing for the patient, because now instead of being a victim of whatever, now they're offering medicine to the rest of humanity. And so, that becomes existentially then part of who they are. And in my understanding, that in offering indigenous traditional interventions, it does two things. It gives an intervention, but it also restores the identity, because what we're doing then is we're validating that who you are as a Native person is a really good thing. It's a really powerful thing, because that's been one of the things that colonization took. And if you only insist on using Western methods, you continue to invalidate who they are as a human being. And how can we expect them to get well when we can't do that? Because in restoring identity, it's what the 23rd Psalm talks about. It restores our soul, and that's what that psalm is about. It took me a long time for that insight to come up. I said, well, whoever wrote that psalm was a warrior king. He'd been in a lot of wars, so had lost pieces of his soul in battle. And so he's asking the Creator to restore his soul. And with Native people, to restore our soul, we need to do it by restoring aspects of who we are as Native people. And once we do that, then we won't have a need to do opiates or to do whatever, because the opiate is also an act of restoring soul, except it's a negative unconscious act. And of course, it does the opposite. And so, so that's kind of, again, my understanding, kind of theoretically about that.
Yeah, and it relates to, there's a quote you have at the beginning of chapter 4 in the first edition. You say, the medicine is already within the pain and suffering. You just have to look deeply and quietly. Then you realize it has been there the whole time. And I really appreciated that, because it's that idea that within the pain and suffering is also the healing. And it reminds me, I have a friend in Oregon, Rod, and he's a traditional provider now, but he wasn't always that way. And once upon a time, I was with him at a Sundance, and a young man came up to him and said, "Rod, I want to become a healer just like you." And he said, "Well, then you'll have to be a wino for 35 years." And I really appreciated that because it was that idea that he was honoring his suffering, that he was saying that he had reached into his suffering and brought himself out or brought out the healer within, and that um, in no way was he negating where he had come from or the path that he had taken. And I wondered if you could say some more about that, those concepts or the ideas from, um, that the healing comes from within the pain and suffering.
Yeah, I think that the archetype of the wounded healer, speaks to that, and again, all of Christianity is based on that. Without that wounding of the Christ, there is no medicine. You have to really pay the sacrifice. And my understanding of the wounded healer is that once we're wounded and then we heal, if we can heal that wound, when we present in front of the patient's spirit detects the scars, the wounding of the healer. And what that does, it activates the doctor in the patient, because through that transference, and once the doctor is activated in the patient, then it starts to heal them also. And but it's important that we heal ourselves as much as we can. Of course, it's always a work in progress, but it's those scars, that the healer carries that elicit the medicine in the patient. And without that, it's just really difficult to elicit that. I mean, because it's not the wise words or the smart words or any of that, because a lot of people know a lot of really smart words and nothing happens. And a lot of people say no words and a lot happens. And so it's that mysterious. And then Jung said it when, in his definition of the transference, he said, well, the transference really is when the sickness of the patient is transferred to the doctor. And it says it several times. And when I talked to some of the Jungians years ago, they didn't believe that he said that, and I had to show it to them, chapter and verse, because a lot of times we're still stuck at transference. It's kind of the Freudian kind where we think it's a dad or mom or sister or whatever, but it goes a lot deeper than that. It has to do with a transfer of actual energy, the consciousness of whatever the problem is with the patient, then recognizes the medicine and the healing that the healer has done, and it shapeshifts itself, and it really helps the patient then to doctor themselves. And that's why most medicine people and a lot of Western providers, they say, well, it's up to you. And there's one medicine man that I used to work with. He would do the ceremony, and he would always tell the patient, he said, we took care of it. He said, it's right here, and it's up to you if you want to pick it up again or not. And so basically, he says, I did what I could, but if you pick it up, then you pick it up. And that's up to you, because a lot of times people want to pick up the sickness again because, they're used to it, or there's lots of reasons for that. And so also the quote there also goes back to something Rumi said in one of his amazing works, where he said, everything has a crack in it, and it's through the crack that the light comes in. And so if the heart isn't broken, then, it's hard for the light to get in, and if the heart is just closed and callous, then not a whole lot can happen. And so that's part of that whole, again, construct and how I see things.
Yeah, I was thinking about how when we label people, let's say we call them an alcoholic, that we put we put a whole story on them, that it tells them, okay, so this is how you're going to live now. And um, so much of what we try to do is to help people find another story, you know, and I love the way that you talk about making friends with the illness and honoring it. You know, it makes me think of in Lakota ceremonies, there's often a place for Iktomi, you know, that that you honor Iktomi and you feed Iktomi, but you don't pay him a lot of attention. You know he's there. Better to make him a place and give him some food than to
Yeah,
pretend that he's not there.
yeah, because then it can sneak up, and then my understanding again, Sundance on that third day, the teaching that was repeated over and over on the third day, Tomi will be there, but Tomi's there to reveal to you your true nature. And boy, what a gift that is, because good, bad, and the ugly, Tomi is going to show you a mirror, and now it's up to you to do whatever you need to do with that. And then to further the notion of consciousness, in my office, I have somebody made me a fetish for the spirit of alcohol. It looks like a bottle of dark eyes, and in the back they attached out of pipestone a little coyote figure. And so I actually have a physical representation of the spirit of addiction, whatever addiction it is. And almost, well, every patient that comes in there, they know what it's for. I said, well, why do you, they think it's the real, they think it's just a bottle of whiskey. And I said, well, it's a stone, it's made out of stone. And they say, well, it's to leave offerings. So as we're talking, I was thinking in your area with the opiate thing, wouldn't it be something if somebody were to make a fetish of the spirit of opiates, of whichever opiate, to where now it's out here in the physical world in spirit form, and now patients could relate to the spirit of the opiate right there.
It seems like a great idea.
And then they could leave an offering right there presently, which is a transitional object for whoever needs to know that. But also, when we go to the spirit of opiates, is something that gets neglected, and that most opiates, are coming from like Afghanistan and places like that, where the energy around that has been violence because of the wars and the killing, and then in the processing and the selling, and then all of that happens with the illicit substances. There's a lot of death that happens. There's a lot of violence. So right into the medicine itself, the spirit of violence is deeply embedded in the spirit of the opiate. And so a lot of times I ask people, why do you want to take that? Because if you take in violence, it's going to do violence to your body. And so there's all these other energies that are involved in the spirit of opiates. And if we have a physical representation of that there, then the patient can actually talk to the fetish. And that becomes a real somber existential moment for the patient, regardless of what they believe in. Because a few years ago, I had a person in the office who was abusing substances, and they didn't believe in they didn't believe in AA, they didn't believe in higher power, and been through a lot of treatment programs. And so I just gave him some tobacco, and the person was a native, and I said, why don't you just, and I call the spirit of alcohol, I call it my friend. I said, why don't you give my friend a gift? I said, just humor me. And so he put the tobacco over there, and as soon as he put the tobacco, he sat down, and he had this expression, and he said, something happened. That's all he could say, is that something happened. And so now he knew at his own spirit level, he had made contact with the spirit of that substance for the first time consciously. And so, it'd be, I'm sure you have artists, a lot of artists in that area, and there might be a little bit of trepidation about making a fetish to the spirit of opiates, but because it took me a while to get the one I have, nobody wanted to make it. And I was working down in Zuni and Navajo country, where there's a lot of fetish makers. But when I asked for the spirit of alcohol, they all refused. And my last day at the hospital, there's one brother came in with a brown paper bag, and he gives it to me, and he says, "Here," and there's the fetish of the spirit of alcohol. And I don't know who made it, but somehow he got it made, and it's been with me for a long time. And it was interesting when I was working at the hospital, and somebody was there in kind of intensive care because of alcohol or some other substance, kind of on death's bed. I would always put that in my back pocket and go talk to the patient. And it really looks like a bottle of dark eyes. And then I never forget, because the nurses and the docs would just look at my pocket, and no one would say anything. They thought I was drinking on the job, but nobody ever said anything about it. And
No
so,
one asked you.
yeah,
That's funny.
they would look at that and they would just look away. They didn't want to know. And I didn't tell them because, I was there to work with whatever needed to be worked at. But when they would see that bottle of dark eyes, they would think, "Oh man, this guy's using himself, and here he is." But I guess that's what they would think, because they would just walk away.
How about that? Yeah,
Yeah, that was kind of the coyote messing with them a little bit. And, you got to have a little fun too, right?
right, right. Yes, indeed.
And,
Yeah, and I think another important concept that you write about in the book is the idea that, well, both the necessity of making an offering and the importance of sacrifice. That in order to gain something, you have to give something, and that seems so important and so different from Western um, medicine, where you deliver yourself as the passive recipient of treatment, and you don't give anything. Your insurance pays for it, and and you don't really offer anything either. That you're just supposed to be fixed, and then um, everyone's surprised when you're not fixed, when it doesn't work. We have a friend who had cancer and went for traditional healing, and the cancer disappeared. And the healers told her, they gave her a protocol to follow for the rest of her life. And they said, you have to follow this protocol or it'll come back, because it's not that far away. It knows where you live.
yeah,
so,
yeah,
so this is what you have to do, and don't forget to do it. Can you, I'm sure you have a little bit more you could say about that, those concepts.
yeah. And again, it's about the relationship with the actual entity. And most Native people know this, except they've forgotten it. So when I say it, they're like, "Oh yeah, my grandma talked that way. She said something like that. That all sickness has a spirit to it." And I say, but it's not just a metaphor. It's not just poetry. It's real, and in that whatever entity has a consciousness to it, and it wants to tell you something. And this is where it's coming to visit. And and I'll tell the people, if somebody comes to your door and you just tell them to go away, well, that's kind of rude, right? So here something's coming to your door and you just want to go away. Well, that's kind of rude also, regardless of what it is, whether it's cancer, diabetes, or some blessing, because a lot of times it's a blessing and we don't even know it. And the only way to, and then I tell them, and the way to make relationship, I say, is the way you made relationship with me. You called, you told me who you are, I asked you who your people are, and then we build on that so that our ancestors are also present there. And that's a real important aspect. And that's why in identifying themselves, I say to go back as far back as you can go. That way your great 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 grandma can talk to my great 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 grandma. So this is the transference at a whole other level. And now by giving the gift, it locks in that relationship of the lineage. And so now it becomes a lot more interesting. And regardless of whether you're going to get relief in the physical body or not, now you know that it has a meaning for you. And very early on, that's what really helped me get through some of the extreme suffering that I was working with in these communities. Uh, Something that that Nietzsche said, where he said that there's nothing more wretched than meaningless suffering. So I think that by giving meaning to the suffering, it empowers us, and we can take on the warrior attitude versus the victim attitude that a lot of times Western medicine puts us in. And so that's kind of my understanding. And again, this stuff works not just with Native people. I mean, it works with all people, because a lot of the people that want to work with me, either they've heard a little bit about me or whatever. Some of them don't really know. They just know that I do something different. And so, they don't want to do the usual because it hasn't worked for them. And of course, the meaning of insanity, which Western therapy should understand this notion, is to do the same thing over and over, expecting different results, right? And we keep doing just the usual cognitive behavioral. And today, 22 veterans are going to commit suicide. There's going to be, I don't know how many hundreds of opiate deaths. And we keep doing the same thing over and over. And that's why in my writings, I incorporate stuff that is off the grid, because it's different. And I'm not insane because I'm not doing the same thing over and over. And so it's kind of for my own sanity in a way.
One of the things that I really like in your ideas is the warrior return ceremony. And I heard you speak on a podcast about trauma, and you were referring to the need to bring people back, and mentioning that at the Sundance they'll do a warrior return ceremony. And I work with a lot of women who have experienced a lot of trauma, and you can see how it's rooted in the kind of difficulties of transcending to communities, of trying to incorporate things. And I think of them as warriors. And I wondered if you could say something about warrior women, and something that might be, particular to women's experience that you've seen.
Well, yeah, actually, I forget. I think it's chapter 6 in the edition you guys have, where I'm dealing with a composite patient, a woman, and a lot of the women that I have worked with have paid, with their physical body, just through sacrifice, through whatever traumas. It could be historical trauma, it could be personal trauma, and a lot of times they have a lot of surgeries. And the way I understand that, and so far most of the women that I work with have really understood it at a deep, deep level, is that you've been sacrificing unconsciously. And it's through those surgeries that on the altar of Western surgery, you gave your blood and flesh offering in that way. And so now you can go back in your intention, and whatever was taken out of your body, even though it might have been a long time ago, you can go back and offer it back to the mystery as your sacrifice. And so that really empowers the person, the woman, to where now whatever was taken now becomes a medicine gift to heal the rest of humanity and the earth. And that's been really, really powerful in that moment, when they realize that I have been sacrificing unconsciously, and to shapeshift that back into knowing. And of course, the warrior does things knowing, and they go, with a knowing that this is going to happen, and you're going to give this, pretty much like in ceremony, it's going to be really hard, but you still go. Or in Christianity, Christ knew this was going to be really hard, but he said they had their dinner, and they sang a song, and he says, let's go do this now. That is beyond warrior. And so a lot of the sisters, that has been really, really powerful experience to be able to go back and shapeshift their sacrifice into a conscious sacrifice that heals whoever, whoever needs healing on the planet. And I tell them it will work. You might never know who you healed with this, but it will heal somebody because the natural law says it has to work that way.
Yeah. Before we finish, I just wondered if you could say a few words about um, the the power of the community and how you bring community into your work with individual clients.
Well, when I was working, deep in the community, I was there, and of course, in a lot of communities, people really know uh, pretty much everything about everybody, and so it becomes again a notion of decolonizing community as to the meaning of wellness, of healing, how medicine works, to where we can go back to the original instructions, and in doing so, that empowers the community then to heal themselves and to reintegrate traditional ways of knowing into their systems, because all communities have systems of health and law enforcement and all kinds of things like that. And so by restoring that, or at least making aware, the leadership aware that this needs to happen, it can start to restore the soul of the community itself. And that is really important, like what you're talking about there with, the tribes you're working with, the urbans, to be able to shapeshift the actual work, how medicine is delivered, and medicine meaning spiritual, physical, psychological, all of it, to those communities, would really restore the soul of the community itself, to where you wouldn't have to worry about, well, how am I going to document this if I do a smudging and a prayer and the person gets well. We should never have to worry about that. I mean, if we do, then we can shapeshift it on and talk about it in Westernese. But if the community becomes empowered and sovereign, really sovereign spiritually, not just politically, then the community can only hire people that follow this way of working, to where instead of colonizing medicine, it becomes a decolonizing medicine. And we can still use Western stuff. I mean, there's a lot of good stuff in Western medicine. And but to where that can, again, the hybrid, it can be there, but it doesn't have to be integrated. It can be said, well, make an offering to the Western Prozac, and now you shapeshifted it, and now it has become sacred medicine. Because in the very Prozac, there's a lot of greed that goes into it, right? The pharmaceuticals, they just want to make a lot of money. So when you eat that, guess what? You're eating greed. And when you eat greed, it wants more. And so this is in Buddhism, this is the hungry ghost realm, where you have real tiny mouths and huge stomachs. So you can never be satisfied with that kind of medicine. And so in dealing with community and a lot of the work I do, I was traveling at least once a month to a community. I haven't now because of the being stuck at home. But that would be, the message that I would try to give. And interesting, most of the time people would come and say, well, we already know this stuff. I said, well, then why am I here? I say, yeah, I guess we just needed to be reminded we really know what you're talking about. So community already knows, but the layer of colonization has made it to where we can't say it because, we're afraid, ashamed or whatever, the boarding schools and all that put on us. And one of the things, last thing I'd like to remind communities is, just like historical trauma got passed down the generations, so did historical healing, because our ancestors knew this was going to happen 7 generations ago, and they did ceremonies so that the medicine would also be coming in with the trauma. And so as we heal it now, we're healing 7 generations before and 7 generations after. So the task becomes healing 14 generations, which which is a big deal, and that's why it's so difficult, because we're doing 14 generations in that moment. And so when the patient realizes that that's what they're doing, it becomes existentially really powerful, because even though they might not care about themselves, they care about their great, 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 great granddaughter. And when we say, oh, I wonder if she's going to have to deal with this if you don't take care of it, because that's how this works. And usually they want to take care of her, that even if they don't want to take care of themselves. So, so yeah, community, it's a really important work. It's really powerful. And these days, when I go to community, they already have the consciousness and the jargon around historical trauma. Everybody talks about it. And it's just a matter of kind of nuts and bolts and figuring out how are we going to do the offerings community-wide, and slowly moving forward with that.
Um, Last, before we stop, I wondered if you could speak to what we've noticed here in Maine is a kind of resistance to community among the part of our patients who have had difficulties with opiates, and a kind of pretending that no one knows what they're doing when everybody knows what they're doing, and maybe Barbara could speak more to that um, more clearly than I am.
I think there's two things. There's the tribes in the area working to come down hard on opiate use and opiate transmission, and bringing it into the land, and trying hard to keep some kind of healthy practice. And then there's the shame that people feel, which I think is because they don't have a paradigm like you're talking about to understand what's happening to them. And the more I listen to the stories of the people that I'm working with, and I understand their stories, the more I really see that they're, you can see all the different forces that are kind of making them feel wedged and caught, and how this happens. And just the conversation today is giving me some ideas. And so there is a feeling of shame and detachment from community, that they can't go back, and that there's been hurt. There's been, people have entered into relationships of trouble, where they've taken things or something has happened like that. And so in our program, part of what we try to do when the time is right is to bring people back into community. So to begin to repair relationships and say, we'll we're happy to bring people together and see if we can bring. And I love that the healing is passed down through 7 generations, as well as the trauma. And I think that's a wonderful thing, a wonderful truth to say to people, because I think that helps people feel that the thread of healing is there in their community and among their relatives, and that when they're, when they can enter in with this new understanding and come back into the family.
Yeah, and working with families, community, sometimes having the family do a genogram, right, to where they go back as far as they can go. And so they have the present genogram, but then I say, well, why don't you add to that 3 generations, just whoever has, and just theoretically see, and then you get to pick down here on this 3rd generation from now, who's going to be the opiate addict, who's going to be suicidal. You get to pick that right now, and we can put an X, and then, but you can also say they're going to be well, depending on what you do. And that is really heavy duty stuff, because now you are, and that's really the truth. That's how it works. And so, yeah, it's a powerful moment, even if somebody's under the influence, and they look at the, the little box or the little circle of their great granddaughter, and of course they're going to want to heal. And then also a question that I like to ask leaders in community, especially if they're doing shaming, and of course there has to be police work and all that. I ask them, well, especially around domestic violence, because it usually is a domestic violence program. I say, well, if this was 300 years ago, would you have that program? And every time they said no, and then I ask another silly question. I said, well, how come you have one now? And see, so now it becomes a matter of, gee, why do we have this program now? Or if it was 300 years ago, would you be excluding this family from the tribe? That would be unthinkable unless, they killed somebody or did some heinous act. So why are we doing that now? It's because we've internalized, the colonizer, and that's what they would do. And so could it be that the spirit of Sherman, the spirit of Custer, has integrated into the spirit of the community here? And that's who's doing it, because they're still alive and well, even though their bodies are on the ground. Their energy's still spinning around here because it's about spirit. And so that's kind of one way of, I know I kind of hit home with you there.
Yeah, for sure.
That's
Well,
wonderful.
I'm going to turn off the recording.